Is the Daily Brief, and thank you so much for joining us this fast. Straight on, we cross over to Nyeri County and bring in the County Assembly Speaker Nyeri, that is John Kagushia. Thank you so much for joining us, John. And in light of what has been happening in other counties in terms of service delivery, how is the situation like in Nyeri?
Thank you very much, Sam. In Nyeri County, we are well, and we are delivering the services to all the people, despite the fact that we have a very serious problem in the country whereby the national government have had a disagreement with the Council of Governors on the revenue that should be shared between the two levels of government. And of course, this has affected very many services and a lot of work that's supposed to be going on here, especially when it comes to the issue of development. Luckily, we have been able to handle the issue of salaries through the revenue collections at the local level. But that also tells you that in terms of delivery, in terms of development, in terms of hospitals, in terms of all the other services that would rely so much on money that is appropriated from the national government, a lot of them are not going on well because of lack of funds. And so we hope that this problem can be resolved as soon as possible, so that all the devolved units, considering that most of the services that the government offer are actually devolved, we hope that this can be resolved as fast as possible so that services can resume to the best level possible.
Nyeri table 7.8 billion Kenya shillings budget to the County Assembly. Was this ever passed?
Yeah, in Nyeri County, we used the previous ceilings that had been used in the previous year, with the hope that once the division of revenue bill is passed, then you do a small supplementary, which then would align our figures to the new figures that have been passed through the division of revenue bill.
How do you intend to finance this budget?
Yeah, of course, the work of financing this budget definitely would be the executive obligation and mandate. But probably speaking from this side, I expect that once we pass the finance bill, which we are going to be doing that within the next month, the month of September, that will give direction on how revenue will be collected from the ground and how we are able to meet the target of 1 billion Kenya shillings that as a county we have set to collect from within the county. But of course, the balance would be collected from or rather would be what we are getting from the national treasury that is appropriated through the division of revenue bill. And of course, we also receive grants from donors and also from the national government. So that is how that budget will be financed.
Well, does this indicate then that moving forward, counties can to some extent be self-reliant when it comes to the issue of financing their own budgets?
It is not, one of the things that every person needs to understand is that the revenue that is collected from all the tax revenues in the country, that money is usually collected to finance the two levels of government. It is not collected to finance the national mandate or the national part of the mandate that we have in the national government. And this money belongs to the two levels of government. So every level of government has its own mandate that has been given through the Constitution. And so whatever is collected then should be shared according to the law to finance the two mandates. And so the issue of being reliant, self-reliant, is to me neither here nor there, because once you collect the county revenue through the rates, because counties do not collect any taxes. The body that collects its taxes is the KRA, and KRA does not collect the taxes for the national government. It does collect the taxes for the two levels of government. And so the issue of being reliant on either the county revenue or the revenue collected by the KRA is really almost the same thing, only that the collection is being done at different levels. But what is collected by KRA, what is important to note is that it is not collected only for the national government. It is for all the levels of government.
In light of what you're saying then, Speaker Kagushia, where does that leave the sentiments expressed by PS Sunkuli when he said that counties need to think of ways to generate their own income?
And unless then we make KRA to be devolved, that would be okay. If counties start collecting taxes, then counties will not have to rely on the national treasury to appropriate any funds to them. Because counties do not collect taxes. Counties collect only rates. And you see, rates are small fees that cannot then finance the mandate that has already been that has already been given to the county governments.
Well, fair point you make there, Speaker Kagushia. But then again, should this stalemate about the transfer of funds persist, what quality of leadership will the County Assembly of Nyeri give the county government?
What quality of services?
Leadership. Should this stalemate persist with the transfer of funds, what quality of leadership will the Assembly give on the matter in Nyeri?
You see, when you do not have finances on the ground in the devolved units, it basically means that sooner than later we are going to have all the services that are being given to the common mwananchi coming to a halt. I mean, our people will go to the hospitals and they will find there is no medicine. Our people will go to will not even get the roads that they have been getting. And water, for example, they will have problems accessing water. And then for that reason, then I think it is incumbent upon us as a county government and county assemblies and also the national government to really come together and have a resolution. I'm aware already that the Supreme Court, through the Chief Justice, has already given guidance on how this matter should be resolved. So we are believing that now that we are the highest court, we should be able to resolve this matter within the shortest time possible. But to realize that the county government through the COG and also the county assemblies forum, CAF, we have been holding hands together, we have been working together to ensure that there is a resolution, because the issue of revenue being appropriated to the county government is really a very, very important issue, which if it is not done away with, if that problem is not done away with, we are going to have a very serious operational issue. Well, and of course, everyone suffers. And you see, we do not have a mwananchi for devolved government and we don't have a mwananchi for national government.
That's very true.
It is the same person who is impacted. It's the same person who is impacted by the two, by the stalemate that is there between the two levels of government.
Do you have a concern that in the recent past we've seen Nyeri government, you know, embark on some very ambitious projects, key among them to revamp Nyeri town? How will that be handled exactly now that funds are not forthcoming?
No, luckily enough, the money that we are using to revamp the town, Nyeri municipality, is not money which is being appropriated by the national government. It's not being appropriated from the national treasury. This is money which is coming from donor funding. And so that program will not stop. That one continues and it will go on as scheduled. We also have funds that we are using to do a level 4 hospital in Narumoro. And this money again is not coming from the national treasury. This is coming as a result of Nyeri County being number 2 in the country in terms of use of its funds. So we were giving almost 250 million. That money is again not in this money which is under stalemate. So that program again for making that level 4 hospital again also continues because really that is just a reflection of good performance and good work that has been done in Nyeri County. So some of those very ambitious projects that you are seeing, they are not coming from the national treasury. They are either coming from the donor funding or coming as a gift because of the good performance of this county.
Well, in May this year, Bwana Kagushia, there were media reports of MCAs in Nyeri engaging in a bit of fighting. How has that situation been handled this far? Okay, we appear to have lost Bwana Kagushia there, but we shall keep interacting with him and get him back so that he's able to handle a couple of other issues that have been raised by the residents of Nyeri in as far as that particular matter is concerned. Remember, this is the Daily Brief right here at K24 TV, and you can talk to us using hashtag K24 Daily Brief using our social media platforms, and of course through our SMS platform, that is 21222. Right about now, would like to take you to Uasin Gishu County, where the Deputy President has been for the better part of the day. A critical event is happening there, and that is presiding over the grand opening of the Living Room International Hospital and celebration of their 10th year anniversary. And one of the key things that this facility will be doing is promoting palliative care in Uasin Gishu County and indeed the rest of the country. So let's cross over to Uasin Gishu and listen in.
Today is an important milestone for the Living Room International Hospital family as it celebrates 10 years of service in Kenya. Your Excellency, I would like to extend my warmest congratulations to the hospital for the sustained growth it has realized since 2009. The US and Kenya boards that provide oversight and the management staff of this institution are commended for their excellent work in developing this institution to what it is today. Your focus on excellence, humanity, justice, mercy, and partnership has ensured continued growth from the palliative care hospice at Kipkorgot to these new premises that are being officially inaugurated today. Your Excellencies, ladies and gentlemen, provision of affordable and quality specialized health care and the need to halt and reverse the rise in non-communicable diseases, most notably cancer, remain key focus areas for the government, and especially so at this time that the country is implementing universal health coverage. The government is encouraging the private sector to join in the journey to UHC and make their contribution. The private sector has an important role to play, and facilities such as this one help to narrow the gap in specialized services and palliative care. In order to meet the health-related sustainable development goals, as well as our national development targets as envisaged in the Vision 2030, the Ministry of Health is committed to implementing health system reforms to accelerate movements towards universal health coverage as a means of realizing the right to health enshrined in the Constitution of Kenya and as prioritized by His Excellency, the President's Big Four agenda. The approach towards UHC is centered on three critical drivers that will focus on: one, expanding the population accessing basic health interventions; two, improving the quality of healthcare services being provided; and three, developing sustainable financing models for health. Ladies and gentlemen, the Ministry of Health and the county governments operate in an environment where resources are constrained. Investment in healthcare from the private sector, faith-based organizations, non-governmental organizations, and development partners are encouraged by the government by promoting public-private partnerships. The Treasury is currently developing a robust framework for public-private partnerships. To accelerate attainment of universal health coverage in Kenya, the Ministry will continue to enhance multi-stakeholder and cross-sectoral collaborative partnerships. In this regard, the Ministry is at an advanced stage of developing a partnership coordination framework that will entrench further regular engagement, support, reporting, and mutual accountability between various stakeholders in the health sector. Finally, distinguished guests, ladies and gentlemen, may I take this opportunity to wish the hospital continued success in the years to come. Before I end, I want to note that This facility has as yet not been accredited by the National Health Insurance Fund, and I assure you that that is a matter that will be taken up, and we hope that it will get accreditation in due time. It is now my great pleasure to request all of you to be upstanding as I welcome His Excellency, the Deputy President of the Republic of Kenya, Dr. William Samoei Ruto, to address us. I'm here. Thank you very much, Your Excellency.
Haya, asanteni. Mheshimiwa Gavana wetu hapa Uasin Gishu, Mheshimiwa Jackson Mandago, mjumbe wa hapa, Bwana CS wetu, viongozi wote na wananchi wa hapa Ainabkoi, hamjambo. Hamjambo tena. Bwana Yesu asifiwe. Wakati
And as we try to get the sound right to that particular clip, currently addressing the gathering at this particular venue, this is Uasin Gishu County, is the Deputy President of the Republic of Kenya, Dr. William Samoei Ruto. He's there presiding over the launch of this particular facility. Palliative care will be at the center of the services that he or this particular institution will be providing. And remember, this comes at a time when a very elaborate conversation has been held right here in the country, especially when it comes to the treatment and management of cancer in the nation. And some people all alluding to the fact that palliative care is indeed a challenge. So let's cross over there and listen into what the Deputy President is saying.
Hapa na sehemu zingine kwa mambo ya matibabu ni muhimu kwamba kanisa, non-governmental organizations, private sector wamekubali kushirikiana na sisi kama serikali katika kuegeza kwa mambo ya matibabu, hasa mambo ya hospitali. Na mimi nataka niwaambie wale walioegeza hapa, in a very special way, to congratulate and thank the people who invested in this facility, this health facility, the church, the non-governmental organizations, the private sector partners who came together to put together this facility, that as the government of Kenya, we will partner with you to make sure this facility succeeds. Tutashirikiana na nyinyi kwa sababu nyinyi mnatusaidia kutekeleza wajibu wetu kama serikali. Mumeungana na sisi hasa katika mpango wa Mheshimiwa Rais wa Big Four kwa mambo ya afya. Hiyo mpango ya Big Four, especially ya universal health coverage, inahitaji wananchi, private sector na public sector kuungana katika kuweka mahospitali ya primary health, mahospitali ya level 2, level 3, level 4, hadi hospitali kama hii. Kwa sababu mbali na sustainable financing ambayo tunatafuta kutoka NHIF na kutoka marafiki partners wengine, hiyo bima ya afya haitakuwa na maana ya kutosha kama hakuna mahali ya kupata huduma ya matibabu. And therefore, the partnership that has put together this hospital is helping us achieve the President's Big Four plan, especially the pillar on universal health, by providing the infrastructure, the health infrastructure, where the beneficiaries of our health insurance program under the NHIF can get quality, reliable, professional service. Na kwa hivyo, I want to say to you, the management, the investors of this facility, you will be our partners as Government of Kenya to make sure that this facility serves the people of this area, the people of this county, and Kenyans in general, by making sure that these facilities are accessible to our contributors, especially those who are on our health insurance program. Ningependa kusema ya kwamba this year, hapa Uasin Gishu, ile mpango ya cash transfer, ambayo tumesema kama serikali ya kwamba mayatima, walemavu na wazee wote wa miaka 70 na kwenda mbele, mbali na kuwapatia pesa ya kujimudu kila mwezi, tumesema wao wote tutawaweka katika mpango wa bima ya afya inayosimamiwa na serikali ya NHIF. Hapa Uasin Gishu mwaka huu tunapanga huduma kwa watu 12,000 na tumeweka pesa milioni 250 ya watu wa Uasin Gishu kushughulikia mayatima, walemavu na wazee wote, so that not only hawatapata pesa ya kila mwezi, vile vile watakuwa katika bima ya afya ya NHIF. Ndio tuhakikisha kwamba wazee wetu wote wanashughulikiwa katika maisha yao kwa heshima, katika maisha yao ya uzee. Na hivyo tutafanya katika kila county ya Kenya. That program is on. Na mimi nataka niwaulize provincial administration kutoka assistant chief, wahakikishe ya kwamba wazee wote na walemavu na mayatima wamesajiliwa katika hiyo program, ndio tusiwaache watu wanyonge nyuma wakati tunapiga hatua ya kwenda mbele kama taifa. And I hope this is clear that the provincial administration in Kenya must ensure that all those who qualify at the age of 70, the orphans and people with severe disability that qualify to be on our cash transfer program and to benefit from the National Hospital Insurance program are all registered and they are properly profiled so that they can benefit, because we are a nation that do not want to leave the vulnerable behind. We want to move along with them. Ningependa vile vile kusema ya kwamba mambo yale mengine mengi ya maendeleo ya vile mjumbe wa hapa amesema ya mabarabara, tunazidi na kujenga hizo barabara. Tuko na bypass hapa ambayo inaendelea, the western bypass. Tunafanya mpango ya eastern bypass ambayo itapita hapa karibu. Vile vile tunataka mpango wa kujenga overpass ili kuondoa msongamano pale Eldoret town kutoka airport mpaka Chepkwele campus kule. Tutengeneze barabara lane 4 ambayo itaondoa msongamano hapo mjini. Hiyo iko katika mipango yetu kuhakikisha ya kwamba we improve the infrastructure around this city so that we can eliminate jams and other challenges that exist currently in Eldoret town. Maneno ya maji, nimeuliza watu wa hospitali hii hawajafikiwa na maji. Tuko na maji ya Elkerin hapa juu. Mimi nafikiria kwamba mkipanga vizuri watu wa Eldowas waweze kusupply hii hospitali na sehemu hii karibu, hiyo maji nafikiri itatosha. Vile vile tuko na maji ya Kipkaren hapa chini. Contractor alifika mwezi uliopita. Hapo tumeweka shilingi 1.2 bilioni ya kupanua hiyo dam ili tuweke maji sehemu ya Kapseret na sehemu hiyo ya chini, na kupeleka maji Mosoriot, Nandi, kona hiyo. Na vile vile hapa Two Rivers juu, we have money to carry out a visibility study ya maji hapo. Tuko na maji pale Kerita, vile vile tunapanga mambo ya Kerita. Tuko na maji pale Moiben, tuko na maji Navilas. So hiyo mipango yote iko katika rada yetu, na tunataka kuhakikisha ya kwamba mambo ya maji, kwa sababu maji ni muhimu, hasa kuhakikisha ya kwamba gharama ya afya inarudi chini. Watu wakitumia maji masafi, we are most likely to reduce our cost of healthcare when people have access to clean drinking domestic water. Na ndio sababu tunakaza mwendo kwa hiyo kazi, na kazi zingine ambazo zinaendelea katika kaunti hii. Mambo ya stima, nishakubaliana na kaunti na wabunge. Tuko na pesa karibu bilioni 1 kuunganisha watu wengine 25,000 kwa huduma ya stima hapa Uasin Gishu County, tukishirikiana na sehemu zingine, and that program is going on all over the country. Ningependa kusema vile vile, kwa sababu leo tuko hapa kwa mambo ya hospitali. Bwana Tarus na chairman pia wa facility hii amesema ya kwamba wanahitaji kusajiliwa na NHIF kuwa accredited, ili wananchi wale wako na bima ya afya ya NHIF waweze kuja hapa na kupata matibabu. Na hiyo mimi nakubaliana na wao. And therefore, Bwana CS, I already instructed your minister, and that exercise should be complete in the next 2 weeks. Kwa sababu NHIF wenyewe hawana hospitali, lakini wako na bima. Hiyo bima ni bure kama hakuna hospitali mahali imejengwa, wananchi wanaweza kwenda kupata huduma. And this is one such facility that gives meaning to the holders of our NHIF card, because they can now access quality professional health infrastructure that has been developed in this facility. And the ministry should have a long-term view of ensuring that we make it efficient for all the facilities that are available to the government of Kenya, both public and private, for them to be accredited so that we can enhance and expedite faster the attainment of universal health coverage. So the ministry must work out a mechanism where private sector, and I want to ask people in the private sector, churches, non-governmental organizations, to invest in health facilities around the country. The government of Kenya will work with the private sector, the people who invest in our health infrastructure, even as we supplement using the public facilities that we have. But we want to encourage the private sector to invest, and I want to ask the ministry to make it that much more efficient and easy for the private sector to be brought on board. The health facilities they develop, so that we can use them for the attainment of our universal health coverage. Kwa hivyo, mimi nimefurahi kuungana na nyinyi hapa. Nataka niwaambie wananchi wa hapa Uasin Gishu, especially the people who have invested in this facility, we will work with you, we will work together, and we will keep our focus on ensuring that we deliver on the commitments that we made as a Jubilee administration. Nataka niwapongeze wananchi wa Uasin Gishu, kwa sababu sasa niko na habari ya kwamba wengi wenu mumetembea barabara ya diversification. Kuna watu wanapanda kahawa saa hizi Kuna watu wanapanda avocado kama mimi na wengine. Kuna watu wanapanda macadamia na mambo ingine. Kuna watu wanapanda. Hiyo ndio barabara ambayo tutatumia kilimo, sio kuzalisha chakula peke yake. Tunataka kutumia kilimo pia kuzalisha uchumi na kuweka pesa kwa mifuko ya wakulima. Ninyi mnanielewa? Nia yetu kama serikali, wakati mnasikia mambo ya food security and nutrition, ni kwa sababu tunataka kutumia kilimo kufanya mambo mawili. Jambo la kwanza, tuzalishe chakula, tuondoe njaa, na jambo la pili, tuzalishe mimea ya cash crops, tuweke pesa katika mifuko ya wakulima na tuongeze uchumi wa taifa letu la Kenya. Tuko na soko ambayo tumetafuta kama serikali, na hiyo soko itakuwa ya manufaa kwenu kama mtapanda mimea ambayo inalingana na ile soko iko ya kitaifa na soko ya kimataifa. So we must go in that direction. Nataka nishukuru county government ya Uasin Gishu. Katika program yetu ya maziwa tulipatia hawa milk coolers 40. Nasikia ya kwamba ngapi imefika bwana governor? 23. Tayari 23 zimekuwa installed. Nia yetu ni kusaidia pia wakulima ama wafugaji wa dairy, kwa sababu tunataka kuzalisha all sectors of our economy. Kigimwa ngole njingele kisete katamaktai. Mnaelewa hiyo maneno? So tunataka wale wafugaji wapate nafasi mzuri, wale wakulima wapate nafasi mzuri, na mambo haya yote tuunganishe ndio tuweze kupeleka taifa letu mbele. Mimi nataka niwaeleze ya kwamba sisi wote kama viongozi, hasa viongozi wa Jubilee, mjue ya kwamba mipango yetu ni kubadilisha Kenya kupitia miradi na mipango ya maendeleo. Maneno ya siasa tuweke kona kwa sasa. Mambo yale mengine yote tuweke kona kwa sasa. Na hatutaki siasa ambayo inagawanya watu. Hata hii mambo ya kusema mambo ya katiba tunataka iendeshwe kwa njia ambayo haitawagawanya Wakenya. Tunataka barabara ambayo Wakenya wataketi chini, wataelewana na tutatembea pamoja bila ya migawanyiko, bila ya wananchi kuwekwa chuki ama kusemekana ya kwamba hawa watashinda, wale watashindwa. We want to ensure that as a nation, whatever it is that is going to be proposed in any format, it must be a national conversation by Kenyans in a sober, in a way that does not create winners or losers, because we want a win-win arrangement for all Kenyans. And Kenyans must speak to each other without necessarily creating camps that this versus that. We've been there before. It is a lose-lose arrangement. We do not want a lose-lose arrangement. We want a win-win where every Kenyan becomes a winner. And I want to encourage Kenyans to focus on ensuring that whatever the debate, it is a debate about issues, and everybody must be listened to so that we can enrich the outcome of any conversation that we have in the country without necessarily...
And definitely some of the issues that are being addressed by the Deputy President there is that in the country's pursuit of universal health coverage, it therefore means that a lot needs to be done when it comes to public-private partnerships, also inclusivity and ensuring that support is given by all agencies across the board. At that note, we'd like to take a break. We return with much more in just a moment.